Good morning, everyone. Welcome to the July 2nd, 2021 meeting of the Board of Health. We have a few people participating remotely today, so I would like to ask if Dr. George Abraham, board member, are you present?
Yes.
DJ Wilson, the Tobacco Control Director for the Massachusetts Municipal Association.
Good morning.
I think we also have Karen Clark from the Worcester Division of Public Health.
Hi, good morning.
Let's see, who else do we have, Kerry?
Jennifer Nakajoba,
Jennifer?
Good morning.
Cassandra Anderson,
Cassandra Anderson? Okay. Very good. So I'd like to call the meeting to order. The first item on the agenda is the review and approval of the minutes from the May 13th, 2021 Board of Health meeting. Do I have a motion to approve the meeting minutes?
So moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. Very good. The next item is to review and act on the possibility of incorporating new changes from the state tobacco regulation into the Shrewsbury tobacco regulation, and the possibility of holding a public hearing. At our last meeting held on May 13th, the Board of Health indicated that it was interested in holding a public hearing to address 5 new items to be possibly added to the Shrewsbury tobacco regulations. And we discussed this fairly at length at the last meeting, but I would just touch upon them, so just to review what we're talking about. The first one is a cap on the tobacco retailer permits. Shrewsbury currently has a cap of 27 tobacco retailers that could be permitted at any given time, and we currently have actually 19 permitted tobacco retailers. At the last meeting, the board was contemplating possibly dropping that to 20, so that would be the first item at the public hearing. The next item was a new policy chart that would help better define which fines are at the state or local level. The next item would be to consider banning smoking bars, vape bars, and hookah bars, which Shrewsbury currently does not do. An amendment to the flavor policy, which would add possess, hold, or keep, which prevents tobacco retailers from keeping prohibited products in their permitted locations for illegal sales to customers they know. And the last one is a ban on rolling papers and flavored rolling papers, which would be basically an outright ban on adding it to the flavor policy to ban the sale of flavored cigarettes. So at this point in time, is there any further comment from DJ or the Worcester Division of Public Health?
Good morning. I would say the update that we took is on number 4. We did have an incident where a retailer was found to be hiding forbidden product. But then he said it was not for sale. He was just keeping it. We then, relying on the state law, had to go with that because the state law only says you can't sell the product for sale. And so, addition of keep, possess, language, and flavor policy would help go a long way to ensure that we are not just holding product for their own free customers.
Okay, thank you, DJ, for that clarification. I appreciate that. Okay, so this item is to agree to scheduling a public hearing on adding those 5 items to the Shrewsbury tobacco regulations. So I think what I'll do is ask for a motion for the Shrewsbury Board of Health to hold a public hearing in regard to these 5 items that I just mentioned. Do I have a motion?
So moved.
I second. Roll call vote, all in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. So the motion passes, and the board will schedule a public hearing on these items when we get to the review of the meeting schedule on the agenda. Thank you. The next item on the agenda is to review and act on a letter of commitment needed for the Massachusetts Department of Public Health Excellence Award.
Steve, it's Karen. I can comment on that.
Hi, Karen.
Hi. So I'm hearing myself and then an echo. So
Correct.
I hope I'm not going to be focused on my echo.
Yeah, unfortunately, that can't be corrected right now, so.
No, it's no problem. So as you may know from the updates that we've shared, we applied for a grant from MassDPH, which there were several options that you could choose from. And it's really to incentivize communities to look at regional models for public health services like we're doing. But one of the other options was to get some funding to do an analysis of the fee structure for the intermunicipal agreement. So since we've been regionalized in Shrewsbury for, I think, 11 years now, we haven't really looked at a cost analysis of the services that we're delivering, which have expanded due to the landscape of public health changing and the skills required to deliver those services. So we received a grant. I think it's around $245,000, and it's for several years. So we'll be participating in hiring a consultant to take a look at the fee structure and how we actually deliver services. And also the Office of Local and Regional Public Health, they have special recommendations from a special commission that all public health departments are going to have to consider around data collection, shared services, and workforce credentialing. So all of that and the fact that we're applying for reaccreditation this year, this was just a really great opportunity, especially after COVID, to really take a look at how we're doing our work. So we hope to hire a consultant sometime over the summer to start working with us on what that scope of work would look like. So MassDPH is requiring a letter of commitment from the Alliance towns, just to say that you're aware of what we're doing and that you're participating in the project. So hopefully that gives some context.
Okay, thank you, Karen, very much for explaining that. I think it's something that's obviously very worthwhile to the Alliance in Shrewsbury, so I see no reason why we shouldn't sign on to the letter of commitment. I'm not sure we need to take a vote on this, but Dr. Abraham, do you have any comment?
No, completely supportive.
As am I, so I think we can go ahead and just sign the letter of commitment. I believe I have to sign and the manager has to sign, is that correct?
Yes,
I believe so.
I have the template that Colleen Bolin had forwarded a week or so ago, so I will complete it and then I will pass it along to the appropriate folks for review and their signature.
Thank you.
Great, thank you very much. Okay, the next item on the agenda is review and discuss coronavirus COVID-19 update. I don't know, Karen, do you have any comment further on COVID-19?
Yes, Sure. So Dr. Abraham can attest to this, that the numbers are going down, which is great. We're seeing 0 new cases in Shrewsbury over the last few weeks. In Worcester's been about 5 new ones a week. But we're still concerned about the 25 to 35-year-old population that really we need to focus on getting vaccinated, as well as people of color that were disproportionately impacted by COVID. So in Worcester, we're part of a 20 citywide equity initiative. So we're getting vaccines to go into the communities, churches, and businesses with minorities to really focus on trying to get them vaccinated. But we're also continuing to just encourage people to get vaccinated, especially because of the Delta variant, which we know is in every state in the country. So we're not totally out of the woods. I mean, we certainly are better than we were, but we still have work to do. And I don't know if Dr. Abraham wants to comment on anything further that he's seeing.
No, Karen has summed it up very well. The only thing is
Thank you.
we are occasionally seeing who have been vaccinated turning positive, no serious illness, no serious hospitalization, and no deaths. So overall, as Karen pointed out, vaccination is really successful in mitigating disease. As the president of the American College of Physicians, I and a number of organizations signed on with the CDC and HHS on a letter to encourage 12 to 18-year-old girls to continue to get vaccinated despite occasional cases of heart inflammation or myocarditis, and that the risk small, the benefit far outweigh the risk. And so that continues to be our message. Nothing further to add.
Okay, I just had a question. Has the Delta variant been actually identified in Massachusetts?
Yes.
Okay, and are the vaccines effective against the Delta variant?
Yes.
Okay. That is very encouraging. Thank you very much. Okay, if there's no further comment, I'd like to move on to the next item, which review and act on the report from the Central Massachusetts Regional Public Health Alliance.
All right, good
I
morning.
guess that's Micah's turn.
That's my turn, yep. So we've had a pretty busy month and a half since the last meeting, with a total of 184 inspections. A lot of that is split between nuisance and food inspections. We also completed all of the pool inspections, an RDNA inspection at UMass, and we had one new business opening, which was the Big Boy Meat Market. Also, a few issues with beavers, as well as camps opening, so there's just been a lot of different things happening. This has kind of been the first month since restaurants have had restrictions lifted, and they're all experiencing staffing issues, so I'll be trying to keep a close eye on that. Seems like my reports have gotten a little bit longer in the last month, just with a lot of turnaround in the industry there, so
Sure.
we'll keep an eye on it.
Okay, thank you. Any questions, Dr. Abraham?
None. Thank you.
Okay, I guess just one other question. aside from COVID-19, is there any detection of mosquito or tick-borne viruses? Is that known out there?
I had saw in the news last night, there was one case of West Nile virus in Middlesex County.
Okay,
That was noted as the first in Massachusetts so far. But we continue to have our news flashes sent out to practice the 5Ds, drain your water, you know, that kind of stuff. Personal protection, long sleeves, that type of thing.
And the last mosquito report I looked at for testing of mosquitoes, I believe, didn't really turn anything up yet, so.
okay, so that's good, something to keep in mind. Okay, thank you very much. So the next item on the agenda is to review the meeting schedule. And in this context, what we have done in the past with tobacco regulation public hearings is to try to hold them in conjunction with a regular Board of Health meeting. So, Dr. Abraham, what does your schedule look like, say, in Fridays in August?
Sure. 5 seconds to check.
Is that,
Oh, 5 seconds to check.
oh,
I can do the 20th or the 27th. Your convenience.
Okay. I believe that the 20th should be fine. So let's tentatively plan on that and check with our other member, Jenny Fishman, who couldn't be here today. We'll check with her to see if she can accommodate that.
Sounds good.
and
Okay,
what time?
You want to do the hearing at 8 o'clock and then follow it with the Board of Health meeting? It's hard to say how long that will take, whether there'll be much input or not.
Sure. And may I have Cherry, Cassandra, and Jennifer's assistance with crafting a letter to the tobacco retailers, just kind of outlining what the board is considering, and that we'll be having a public hearing once we finalize the date and time? Okay, thank you.
Okay, great, very good. So at this point, do I have a motion to adjourn?
So moved.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
I vote aye, so the meeting is adjourned. Thank you very much.
Thank you.
Thank you.
Thank you for everyone participating.
Thank you.